Okay, well, it's nice to meet both of you, and thank you very much for being available and willing to join the Real Truth About Health conference.
Glad to be here.
Yes, on some level, I like some other panels better than this, and I'll tell you why. Dr. Esselstyn says you can be heart attack proof. I love it. I feel like I have so much control. Just follow a whole food plant-based diet, and I don't have to worry about that. Other people talk about you follow a plant-based diet and you never worry about diabetes. Amazing. You don't smoke cigarettes, you don't have to worry about lung disease. This is all amazing. But chronic kidney disease, I wish that word would just go away. There's enough things to worry about. And when I look up the statistics, it's not like 1%. I see crazy numbers. Like I'm looking at it and thinking, is it saying that 15% have it? Who even knows what it is? No one even talks about it outside the medical world. So I kind of just want this all to go away. I don't want to take another thing on our plate. But I'm hoping that you're going to tell us that it's not as out of control as it sounds, and that actually we have some influence over kidney health. But I don't know, there's not as many books written about it. So maybe you could just each tell us what you've been doing for the last 15 years and what we need to know about chronic kidney disease, and then I'll go into more specific questions.
Sure. Do you want to go first, Dr. Hashmi, or you want me to? Okay. Well, you're absolutely right. So I started in kidney disease in 1998, straight out of school, which is not something you could do today. You have to work for a year as a dietitian before you can go into kidney disease. But I did, and I started in a dialysis center. And over the years, I kept seeing, I'm in the South, obviously by my accent, and just south of Memphis, Tennessee. I kept seeing dialysis centers go up like a Walgreens on every corner. And I began to ask the question, why in the world are we not doing something about this? Just like you said, Stephen. And so when I was doing my master's work, I started just doing more research and started looking at what they were doing in Europe. And they were putting patients, instead of just watching a patient fall dialysis, every 3 months go to their doctor appointment and they just fall forward to dialysis, they were actually putting patients on low protein or very low protein diets and supplementing those back with keto analogs. So I started just trying that with patients. We didn't have keto analogs at that time. This was back in 2012. We do now. But I just began trying it with patients, and it was amazing that their GFRs got better and better. As far as I'm a plant-based dietitian as well. So when I started in dialysis, I began to think, back then I thought, well, plant-based nutrition and kidney disease really don't go together, but actually they do. And the more research that comes out, even in dialysis, patients can still eat a plant-based diet. And there is research showing that they are, have great numbers and are healthy. But in the pre-end stage population, eating a low protein plant-based diet will slow progression. But also, you can't, I try to say, I tell my patients, don't just think of yourself as kidneys. You know, even with everything that Dr. Esselstyn did, most kidney patients die of cardiovascular disease, of heart disease. So all these things go together because there's so many comorbidities that go along with kidney disease. So, you know, yes, there's absolutely something that we can do, but we do have to raise awareness. People have to know what kidney disease is. Refer them to a dietitian, refer your patients to get help nutritionally, which is not happening. It's a little bit better with value-based care companies coming into play. But just sound the alarm to patients out there that, hey, if you're a diabetic or you're hypertensive, get your urine checked to even know you have kidney disease. And if you have kidney disease, get to a renal dietitian or a doctor who knows about nutrition immediately and get help, because we can slow progression. We can keep people off dialysis, and there is hope.
Well, that's great. Thank you so much, Jen, for giving that great overview. You know, Steve, you started by saying something very interesting, which was the statistic is around 15% of the people out there have kidney disease. But let me give you a different statistic. Same information, 9 out of 10 people who have kidney disease don't know they have kidney disease. That's a really important statistic to remember, because more so than the statistics you have, I would argue that the idea of 1 in 7 having chronic kidney disease, there's actually much worse statistics. It's just that most people never get it checked. Number two is for everybody who's in the field or not in the field, kidneys are very complex to understand. And because they're complex, most people don't really grasp how they function. You know, when you're born with about 1 million kidney cells, what we call nephrons, in each kidney. And the only thing that happens to them, and this sounds like doom and gloom, but the only thing that happens to them as you get older is they die. And so part of life, there's a little bit of an echo. Part of life is really figuring out what are those things that are going to cause that to accelerate. We're all going to age. There's all sorts of changes that are going to happen. If you look at my pictures, I had a full set of hair. I don't. That's part of it. But part of understanding that is what are those 3 things that are going to cause your kidneys to accelerate that decline faster than anything else? It's diabetes, it's blood pressure, and it's weight. That's it. That's literally it. If you were to look at all of the speakers that you've had so far on your show and talk about all of the things that they're talking about, whether it's heart disease, whether it's cancer, whether it's lifestyle, no matter how you look at it, everyone is saying exactly the same thing. And it comes to exactly those 3 things. Now, the reason kidney nutrition becomes so darn important is because we meaning the collective nephrologists, dietitians, social workers, and the entire field has gotten the idea of looking at nutrition as very black and white. And the problem with looking at things black and white is you miss everything because life is all gray. That's why I'm wearing gray. Total joke. But the idea behind nutrition is we have these very set criteria that if you're somebody with kidney disease, you need to cut out potassium. If you're somebody with kidney disease, you have to go to a protein diet that's going to be very, very low, except for what is the ideal type of protein. When you go on somebody who's on dialysis, we think of people on dialysis as that's it, you failed. Now you're on dialysis. In fact, it couldn't be the opposite. The data shows that on dialysis, your risk of dying in 5 years is 50%. Or another way to say that is when you look at your dialysis unit, out of 5 chairs, 1 of those chairs is going to be empty by the end of the year because they died. And so part of that is not just in kidney disease, but in dialysis, there is so much that you can do to lower your risk of not just death, but disability, and to improve the quality of your life. So for me, I've been in this field for quite some time now, and I can tell you a lot has changed in terms of the options for medications, but a lot of the simpler stuff of just making better choices and having people feel like they're in control, we've taken the control away from them. We talk about heart disease and we talk about all these beautiful things that we can reverse heart disease and we can do all that stuff. But there's nobody out there who's saying that if you have kidney disease, that number 1, it's not a death sentence. And number 2, that there is hope.
Mm-hmm. Yeah.
Okay, so based on your real world experience of real people that come to you, what works to eliminate high blood glucose, or to make people not diabetic and not have high blood pressure and not be overweight? You know, what is we have different people speaking on diet, but what have you actually found is the most effective way to prevent diabetes, high blood pressure, and being overweight?
I'm going to say, I mean, that's very, okay, I'm going to say individuality, like being individualized. Don't just, like Dr. Hashmi said, everyone's different. It's not just a blanket kind of diet or plan. It kind of depends on where people are coming from, what's causing their problems. You know, most people who have kidney disease are diabetic and hypertensive. Those are the 2 main causes of kidney disease. However, there are many genetic conditions also that can cause kidneys to be damaged. And so we have to take all that into play. But, you know, if you, it's like Dr. Hashmi was just saying, it's all kind of the same thing, you know, a whole overall, if you had to just give an overall like blanket guideline, a whole food, sticking with whole foods, mostly plants, high fiber. But then when it comes with kidney disease, there's so many nuances that you have to look at. You know, and I'm grateful. So KDOQI is something that's like the national guidelines for kidney disease. I'm so grateful that they changed it, because they changed those, like with potassium, with phosphorus, as you go by the patient's lab. So we have to, the biggest thing that needs to happen is more patient. We need to catch kidney disease. We actually need to test people and catch it earlier, because like you said, 9 out of 10 people don't even know they have it. And then get them to somebody who can individualize a plan for that person, according to their unique state, their stage of kidney disease, their level of potassium and phosphorus, culturally, what do they eat? All those things come into play.
Yeah, that's an excellent answer. You know, the only thing I would add to that is, as you think about where we're headed, when I'm sure this is the same thing for Jen as well. You know, when I got into medicine, at that point in time, plant-based diets weren't sort of in flavor. And then we saw this whole tidal wave happen where now everybody knows that to use the word plant-based is this hip thing and it's really cool and all the cool kids in high school are doing it. But this is where the trouble lies. There's a healthy plant-based and there's an unhealthy plant-based. And so for folks like myself, you know, when we talk about what is the ideal diet to eat for kidney disease, we're talking about minimally processed whole foods is what we're encouraging people to eat. We're actually trying to shift a little bit away from using the term plant-based diets because of the fact that there's a lot of really highly processed plant-based foods that are now on the market. And for patients, they're so excited, they come to me. So I'm a kidney specialist and an obesity medicine specialist, and I have both practices. And the challenge that I see is patients are desperate to do the right thing. They're looking, and every single time they either look at YouTube, they look at social media, there's some guru out there who's saying, eat this and you're going to fix everything. And then they turn around and there's another guru out there who's eat this and you're going to fix everything. And at the end of that, it becomes very, very difficult if you're just somebody who's got limited income coming in, who maybe have 3-4 people whose mouths you got to feed every day, and you're working 10, 12 hours to figure out, okay, what do I really do?